All right, so dermal puncture is a way to capture capillary blood as opposed to venous blood, which is collected by venipuncture. It's very similar to venous blood, but some of the analytes may differ in concentration. In particular, glucose is higher in capillary blood compared to venous blood. Potassium and calcium and total protein are usually lower because of dilution from tissue fluid. And then you'll want to note on your order what type you actually collected so they can use the appropriate reference ranges for that collection type, because there will be different reference ranges for capillary versus venous blood for some analytes. And this is the preferred method of capturing or collecting blood for babies because it collects a very small volume. And you don't want to basically take all the blood from babies because they can actually get hospital-induced anemia due to too much blood collection, especially babies that are inpatient for a long time and they get blood draws multiple times a day. They can actually get anemia from the labs that are drawn. So you try to draw the smallest volume possible. And then we also collect capillary blood a lot of times for point of care testing, which is testing that's done at the patient's bedside. Oh wait, my little thing here. So this is actually a little lancet that comes in and punctures the skin, goes through the main epidermal layer and into the dermis, and it goes into the capillary bed where the blood will then leak out. And you notice there's a lot of nerve endings in there, so that's why it's a little more ouchy than a venipuncture, but it does collect a very small volume. And with automated instruments, sometimes all we need is a very small volume. All right, so there's different puncture devices and collection tubes. So we collect them into micro hematocrit tubes or into microtainer tubes. They're basically just really tiny, maybe hold 1 ml of blood max, even less than that, of volume. They can contain anticoagulants and additives, just like your vacutainer tubes, and they use the same color coding system. And you want to mix gently to avoid hemolysis. And then each of these lancets has a set depth of how deep the blade will go. So depending on the size of your patient, you would choose a different size lancet. So babies have different sizes. So there's even like preemie size, micro preemie size, newborn size. So that way it's going to the appropriate depth and you don't accidentally hit the bone of the child's foot, because that can cause, 1, a lot of pain, and 2, it can lead to infection. And then the blade auto retracts for safety of the person collecting the blood. So dermal puncture does have a higher likelihood of hemolysis because you're cleaning that site with alcohol just like you do for a venipuncture, and then that blood is actually going onto the skin where that alcohol was. So if you don't let the alcohol dry completely, that can lyse the blood. So this is why typically you always wipe away that first drop. There's some POCT instruments that tell you to collect the first drop, but usually you're going to wipe it off. And then you want to avoid milking. Anyone ever seen how you milk a cow where you go like down the udder? This is what you do like the finger, where you would take it and then like scooch your finger up the finger and try to milk it, and that can cause hemolysis. You're just supposed to apply pressure and release. You're not supposed to like try to travel up the finger. That's considered milking and it can cause hemolysis. And then if you try to scrape the blood into the tube, because like say it's starting to clot and you're just trying to eke out that last little bit, it can cause hemolysis from damage to the red blood cells. So it's best to wait for the blood to form a nice little juicy droplet and then let it slide into your collection tube. All right, so the order of draw is different for capillary blood because of the rapid clotting that happens at the puncture site. So that rapid accumulation of platelets, you kind of have to collect things in a different order. So the first thing you're going to collect is any blood needed for a blood gas. Then you'll collect blood for a blood smear because you don't want to get clots in your blood, little micro clots in your blood that will mess with your blood smear. Then lavender, because that has an anticoagulant in there. Then your heparin, which is your green top, followed by your gray, which is oxalate and fluoride. And then very last is your serum one, because you don't care if it's already clotting at that point because you want that sample to clot. So you'll always do your gold one last because you don't care if it's already clotting. But all of this is aimed to basically race against the clot time. All right, some technical tips. These capillary tubes and micropipettes fill by capillary action. So you can touch the collection tip very lightly against the skin or against to the drop of the blood, and it will kind of wick into the tube or into the capillary or microhematocrit tube. And for a microhematocrit or a micropipette collection, you're going to hold that tip horizontally and keep it against the drop the entire time. And that helps prevent the introduction of air bubbles, Because if you get an air bubble in there, that means one, you don't have as much space for the sample. And two, if it's a blood gas, you've now introduced air, and that will change the concentration of the different gases in their blood. And then you'll seal it with clay on the non-contaminated end. For the micro collection tubes, they usually have this little cup on them. And you'll hold the cup so that the droplet just kind of slides down in there. So you want to hold that vertically or kind of slanted so it can just slide in by gravity without scraping. And then you'll tap the tubes to get the blood to go down to the bottom of the tube so it can mix with the additives. Then you'll cap it and gently mix it by inversion. All right, so general procedure, you want your patient seated or lying down, so in case they pass out or something, they don't have far to fall. You want to always identify the patient correctly with the full name and a unique identifier. If it's a baby, they obviously can't talk, so you would ask a nurse or their caregiver, like a parent, whoever's brought them in. And you want to choose a site that's free of calluses. That's why we don't do capillary punctures on the index finger. This one has a lot of calluses. Your ring and middle finger have way less calluses compared to your index finger. You want to avoid scars because there's not a lot of blood flow in a scar, bruises, edema, areas of infection, or if a very cold limb. So this is often a problem in critical in patients in the ICU because they don't have good circulation, and it's actually considered a moderate to high complexity test to do a capillary draw on a patient in the ICU because of these issues with them being cyanotic or having cold limbs due to poor circulation. So a lot of times you need to warm up their hands before you do the draw, or with babies, you warm up their little heel. They have little packs that you crack and warm up, and you hold that there for a few minutes to get it warm to help the circulation. Then you clean with alcohol and let it dry so you don't hemolyze. And then you will use the appropriate lancet for the size of your patient. You'll wipe away that first drop of blood with a piece of gauze and then collect the subsequent drops. There are some point of care test manufacturers that do ask you to collect the first drop. This is why training is important on how to use your particular point of care machine. And then you'll apply and release even pressure about an inch or two, about half an inch to an inch above the puncture site to help improve blood flow. And you'll avoid that milking motion and avoid scraping the blood off the skin. You want to work quickly, you have to do this in basically under 2 minutes. If it takes longer than that, you'll have to do another puncture. After you've collected all your samples, you'll apply pressure with the gauze, bandage and assess the patient, and then of course, label the specimen before you leave the patient's side. All right, so for finger sticks, you're going to use your middle finger or your index finger, and you want to be on kind of the middle of the pad, not on the outside edges. And you want to avoid the pinky finger because it's tiny and it's pretty shallow depth to the bone. And you want to see on this picture, you actually want to lance it this direction rather than this direction. And that basically helps the blood fall into the middle of the pad rather than off to the sides. So it basically goes the direction you want. And you can have them dangle their hand if they're seated before the draw so that blood kind of cools down at the bottom. Let gravity help you. And warm it if needed. For a regular adult patient, you usually don't need to warm it unless it's like previously cold hands. Clean it with alcohol, let it dry. And then when you hold the patient's hand, because you want to prevent them from jerking away, you want to like kind of clamp it between your fingers and thumb, and you want to apply pressure to the finger that you're puncturing, because without that pressure, sometimes the skin tries to rebound and basically get away from the blade. So you want to hold pressure there so that the blade will go to the full depth it's meant to. And then you will alternate applying pressure and releasing about half an inch to an inch above the draw site, so basically in that second knuckle. And that will get satisfactory blood flow, usually. All right, so for heel sticks, which are tiny little baby feet, you will do the side of the heel because you see they have a heel bone in the middle. So unlike with the finger where you do the middle of the pad, on baby feet, you do the side because you want to avoid bones. You want to warm the site to improve blood flow, and then you clean it with alcohol and let it dry. And there's kind of a fun way to hold the little baby foot. I'm going to borrow someone's little baby foot. I just think these are so cute. All right, so you're gonna make a kind of a C with your hand. Okay, flip the baby's foot. And no, there we go. Okay, C with your hand. You can kind of leave a little hole for yourself to hold it. Their feet are so tiny. Yeah, we'll see. And the key thing with this, if you have these fingers, I don't know if anyone's ever tried to hold a newborn baby's foot. They are not still. All right, they kick a lot. So you want to make sure that you're not squeezing these fingers together. You want to make sure you're not squeezing the top of their foot with your other fingers, because that can leave a bruise on the baby's foot, and parents don't like it when you bruise their babies. All right, so avoid squeezing your fingers together over the top of their foot. And you'll do that and hold them still as much as possible. And it also helps, you don't want to be holding the baby's foot, their leg straight up, because then gravity is working against you. All that blood has to pump against gravity. It's best if you try to keep that foot as level with the rest of the baby as possible, or even lower if possible, to let gravity help you. All right, so another thing that we do a lot with babies is 24 to 48 hours after they're born, they collect newborn blood to do screening to test for different metabolic diseases or genetic diseases like cystic fibrosis or galactosemia. And they do this by collecting it onto filter paper. And one way is to basically directly dab the blood onto these circles from the baby's foot, but that can introduce infection. So you can also collect it into a microhematocrit tube and then use the microhematocrit tube to dot the filter paper. But it's important to fill the entire circle so that there is an adequate amount of specimen to do the test. And then you'll let it dry for 3 hours without touching anyone else's card because you don't want any, contamination. And then you'll mail it to the testing center, and the turnaround time on these are very fast because any metabolic condition they have, you want to diagnose right away so you can treat them so they can avoid long-term deficits. All right, so dermal puncture. Identify the patient, avoid areas that are shallow depth to the bone, and choose a lancet with the appropriate depth. Use gravity and warmth to your advantage to improve blood flow, and then avoid hemolysis by letting the alcohol dry completely. Don't milk, and avoid scraping the blood into the tube. And you need to work quickly to avoid clotting after puncturing the skin. All right, ta-da, that's dermal puncture. All right, here we go. Let me stop this.